Welcome, my name is Dr. Michael Simmons. I'm interested in sharing with you some information about sleep-disordered breathing. Now, sleep-disordered breathing ranges from simple snoring to sleep apnea, and it can get even more serious. Sleep-disordered breathing is this enormous topic, and snoring is probably the most common or prevalent manifestation of sleep-disordered breathing. And lots of people snore. It can be simple snoring when people are very tired, or if they've drunk some alcohol before bed, or sometimes it happens because they're congested. But for a lot of people, snoring is an every night experience, and it makes them very difficult to share a room or share a bed with. So it becomes a real social issue. Now, if snoring is very loud or very dramatic, so that people actually stop breathing for a little while, they do this, and then an enormous, that's usually sleep apnea. In fact, if you stop breathing for 10 seconds or more, it's an event, a respiratory event that's called an apneic event. So somebody that stops for 10 seconds has an apnea, and they may have 10 apneas an hour or 100 apneas an hour. It can be very serious. Some people don't have a complete apnea, they just have a restriction in breathing, and that restriction is sort of a narrowing of this soft airway, and that can be manifested as sort of a restriction in the airflow. So it's more like this. But if you keep doing that for hours on end throughout the night, the oxygen level in your bloodstream goes down and your sleep is very poor. You may be in bed for 8 hours or 10 hours and feel like you've got enough sleep from an hour point of view or a time point of view, but in the morning you don't feel like you've got any rest whatsoever. And you know what? If you're sharing the room with somebody and making those kind of noises, they probably